This presentation will guide you through the steps for an effective brief intervention for at-risk alcohol use. This process, however, can be adapted for any other psychoactive substance. Brief interventions are short, structured conversations based on the principles of motivational interviewing in which the provider explores problems, recognizes ambivalence, and listens for change talk from the patient. Change talk refers to any statement in which an individual expresses a willingness to quit or cut down or acknowledges the negative aspects of substance use. Ideally, brief intervention should be conducted immediately following the screening with individuals who screen at the moderate risk level. For those screening at a high risk level, the brief intervention may be used to motivate an individual to accept a referral to a higher level of care. Brief motivational interventions are based in the premise that individuals who have experienced problems can identify the potential benefits of reducing substance use, though they may not want to change their behavior due to the high cost of giving up use. For example, a patient may realize that his alcohol use causes tension with his spouse, but may continue to use because drinking is a way of reducing stress. The core of a brief motivational intervention involves exploring the benefits of continued substance use compared to the potential benefits of behavior change. Brief interventions typically utilize an informational brochure to provide feedback to patients about the health, social, and legal risks of use. The provider offers advice about recommended limits of use, for example, the guidelines for lower risk alcohol use, discusses the pros and cons of behaviors in light of the patient's own goals for the future, works collaboratively to make and strengthen arguments for change, and supports change by helping patients design an action plan. In an effort to reduce the stigma related to at-risk substance use, we embrace a non-judgmental attitude towards use. Substance users may do things that are unhealthy or seen in a negative light, but that does not mean they are bad people. Harm reduction refers to policies, programs, and practices that aim to reduce the harms associated with the use of psychoactive substances in people unable or unwilling to stop. The defining features are the focus on the prevention of harm rather than on the prevention of drug use itself. The approach seeks to bring to light and balance the costs and benefits of use, provide accurate information to patients so that they can take responsibility for the decisions they make, and facilitate access to care. Harm reduction complements approaches that seek to prevent or reduce the overall level of alcohol and other drug consumption. Access to good treatment is important for people with alcohol or drug problems, but many people with substance problems are unable or unwilling to get treatment. Furthermore, the majority of people who use psychoactive substances do not need traditional treatment. There is a need to provide people who use alcohol or other drugs with options that help to minimize risks from continuing to use and of harming themselves or others. Many people who use psychoactive substances prefer to use informal and non-clinical methods to reduce their consumption or reduce the risks associated with their use. Miller and Sanchez proposed 6 elements summarized by the acronym FRAMES, in which to provide a framework for brief intervention. Most health professionals delivering brief interventions provide patients with personalized feedback on their risks for substance use problems based on such factors as their current drinking or substance use patterns, problem indicators such as laboratory test results, and any medical, social, or psychological consequences of their use. This is often done in the context of a screening test such as the audit or assist. Perceived personal control has been recognized to motivate behavior change. Therefore, brief intervention commonly emphasizes the patient's individual responsibility and choice in reducing or stopping use. In some types of brief intervention, professionals give patients explicit advice to reduce or stop use. While expressing concern about the patient's pattern and the related health risks, the healthcare professional may discuss guidelines for lower risk drinking or drug use. Utilizing tools such as a decisional balance or readiness ruler can help develop discrepancy and promote change talk, thereby enhancing motivation. Health professionals providing brief intervention may offer patients a variety of strategies from which to choose. These may include setting specific limits on consumption, developing skills to avoid use in high-risk situations, and learning to cope with the everyday problems that may lead to drinking or drug use. A warm, reflective approach that attempts to understand the patient's point of view is more effective than an aggressive, confrontational, or coercive style. Research has found that patients' drinking was reduced by 77% when practitioners used an empathic counseling style as opposed to 55% when a confrontational approach was used. The practitioner should use an empathic style throughout the brief intervention. Health professionals delivering brief intervention commonly encourage patients to rely on their own resources to bring about change and to be optimistic about their ability to change their behavior. Feedback is the first step in the delivery of a brief intervention. This component highlights certain aspects of a patient's behavior using information gathered during screening. It involves an interactive dialogue for discussing the screening findings and is not just provider-driven. Feedback should be given in small amounts. After describing the risk level and meaning of the level, low, moderate, or high, the provider then gives a specific piece of feedback and asks for a response from the patient. Most health professionals provide patients with feedback on their risks for substance use problems based on their presenting health concern. Factors such as an individual's current drinking pattern, laboratory test results, or other medical consequences of their drinking may be used for feedback. For example, a physician may tell a patient that his or her drinking may be contributing to their hypertension or may increase their risk for heart disease. Since screening identifies many who are at risk and not yet experiencing harms, this may not always be possible, but feedback should always be personally relevant. The provider should always ask permission before presenting the screening scores or in providing feedback. Note that feedback should be provided using an empathic style, that is, neutral and non-judgmental. And the practitioner should always avoid labels like drug addict and alcoholic. Eliciting personal interpretation, which may be done at several points during the intervention, entails asking the patient what they think about the information and what they would like to do. You can do this by asking one of the following key questions. Where do we go from here? What would you like to do about that? What concerns you most?
So Deborah, thank you for sharing the information with me. Would it be okay if we discuss the results together? So based on your answers, you scored in what we consider the moderate risk category, which means you're at some risk for some health or other problems because of your drinking pattern. Yeah, you had mentioned that you have these heart palpitations after a heavy drinking episode. That's because acute alcohol ingestion can cause these kind of short circuits in the heart's electrical rhythm. What are your thoughts about that?
Emphasize the patient's responsibility and choice for reducing substance use. Perceived personal control has been recognized to motivate behavior change.
So In order to reduce your risk of some of the symptoms that we talked about, my advice to you is that you cut back on alcohol or stop drinking altogether. Now, the decision to change is entirely up to you. May I share some information with you that has helped other people to lower their risk? So for women of your age, we recommend no more than 1 drink per day or 7 drinks per week, and no more than 3 drinks on any one occasion. And that's because we know that individuals who regularly drink above these limits put themselves at risk for long and short-term problems because of their drinking. What are your thoughts about some of these lower risk drinking limits?
During the brief intervention, healthcare professionals should give patients explicit advice to reduce or stop using. While expressing concern about the patient's current drinking and the related health risks, the provider may discuss guidelines for lower risk drinking, for example. When discussing the recommended drinking guidelines, it's also important to educate the patient on the definition of a standard. Throughout the intervention, and especially while providing advice, monitor the individual's readiness to change. The provider can evoke change talk in patients by asking open-ended questions, utilizing decisional balance and pros-cons exercises. It can be helpful to first have the patient talk about what they like about their substance use, the good things, and then ask about the not-so-good things. Lastly, engage the patient in a conversation about what any change might look like.
So let's talk about some of the pros and cons of your drinking. What would you say are some of the good things about your drinking? What about some of the not so good things? Okay, so on a scale of 0 to 10, where 0 is not at all ready and 10 is entirely ready to change some aspect of your drinking, where would you put yourself right now? So that's great. That means you're pretty ready to make a change at this point. Let's talk about what that change might look like. If you could envision your life a few months down the road, how would you see it in terms of alcohol? How would drinking fit into that?
Discuss a variety of change strategies from which the patient can choose. These may include setting a specific limit on substance use consumption, learning to recognize high-risk situations and developing skills to avoid using in those situations, planning ahead to limit use, pacing one's use, and learning to cope with the everyday stresses that may lead to drinking or other drug use. Drawing on past successes can help build patients' self-confidence that change is possible, and identifying challenges ahead of time can help patients plan for them. Creating an action plan is a powerful tool that often gets skipped. Help the patient identify exactly what they can do to make the changes they are talking about. If they are willing, write it down for them. Encourage patients' confidence that they are able to make changes in their substance use behavior. Remember that the action plan should match the patient's readiness to change.
So strategies that have worked for other people are things like keeping a diary of their drinking, or maybe picking 1 or 2 days per week where they don't drink altogether. What do you think might work for you? What do you think your first steps might be? You mentioned that you were able to cut back on drinking in the past, and I'm wondering what allowed you to be successful with that. Okay. What do you think might help you in being successful this time with your goal? Okay. Can you foresee any challenges or obstacles? Okay. Those sound like some really positive ideas and a really great plan. And you seem like a really resourceful person, so I think you'll be able to do it.
At the end of the brief intervention, summarize the conversation emphasize the individual's strengths, and highlight any change talk. Remember, the goal is to develop an action plan. Give patients self-help materials or brochures that will help them carry out these strategies. Self-help materials often include drinking or drug use diaries to help patients monitor their abstinent days and the amount consumed when drinking or using other drugs, record instances when they are tempted to use or experience social pressure to drink or use other drugs. Thank the patient for their willingness to share with you and offer to assist in any future behavior change efforts.
So you mentioned that on the one hand, drinking can kind of help you unwind after work, but on the other hand, you become a little concerned about those heart palpitations and maybe a health issue. So we talked about a change plan that you think might work for you, and that involves cutting back on the number of drinks that you have and maybe not drinking at all on 2 days per week. Does that sound right? Or is there anything I missed? Okay, great. So here's a brochure that has some additional ideas that might be helpful to you as you're undergoing this change. And on the back, you can write down the plan that we talked about. Okay. Well, thanks so much for coming in and being open to talking about these things. And I think with your past success and your energy, you're going to be able to do a great job.